So I am Susan Launder, and I am the nurse manager of our inpatient unit that kind of was the first unit to have the patients that we started our ERAS program for. So I'm excited to present today and share some nursing basics, education for all, so the nurses and the patients. So I think what we're hearing a lot of themes of, we do have a lot of crossover in everything we do in our team. So topics that we share, it takes everybody from all disciplines to make things happen. So some objectives I'm going to talk about is to verbalize how to start up and roll out a successful ERAS program, particularly on the inpatient medical surgical units. Talk about some roadblocks that we have when looking at an ERAS program, because there are bumps in the roads everywhere you go, and to verbalize some key components of having successful sustainment of a program once you get it started. So Dr. Young-Faddick shared it does take a whole team. And when you go to start the program, you need to bring everybody on board and have a lot of those conversations. So from a nursing standpoint, we're looking at the nursing team themselves, and this goes from leadership all the way down to our bedside nurses. And I'm very thankful to have a lot of the nurses here today, because without them, we couldn't do what we do every day in our programs. It also takes our nursing informatics team to help us. It's great the doctors build the orders, but then from nursing informatics, how do we also put that together for nursing so that the orders fire the tasks that we need, and so that the nurses are aware of all the things that need to happen within the protocol, because as they're busy taking care of multiple patients, not just one ERAS patient, but sometimes 3 to 4, how do they make sure that all those tasks are there so they know what they need to do? Working with our physicians, talking about what's missing, what can we make better, how does that look? So it's a constant conversation to have. Food and nutrition services. If we don't have the food on the floor, we can't feed the patients. So it's a topic we need to continually have. We've always had, at Mayo here, we had a food service that patients got their meals at the same time every day. And recently we went to patients can order their food now. So if they meet criteria, they can call and order their food. Not 24 hours a day, but they can order their food during our time frames. And that's a great thing. But when patients come back from surgery, they're a little sleepy. They're not really thinking about ordering food, nor is that at the top of their list. And so we get the order. Yes, the patient's independent, can order their food, but we had to remind our nurses they're really not ready. You need to call and make those first orders, right, to make sure food's available. And then if it's past the time frame, having food available on the unit. So working with the dietary team to make sure we had items